The broadcast is now starting. All attendees are in listen-only mode.
All right, welcome everybody. This is John Updegraff. I'm just here to kick things off for today's virtual brown bag with Paula Pietromonaco, Bert Uccino, and Chris Dunkelstetter on close relationship processes and health. This will be a brown bag moderated by Kate Sweeney, who's also on the line here. Say hello, Kate.
Hello, everyone.
The first thing I'm going to do is basically just go over some of the technology behind these virtual brown bags, especially if you guys haven't joined in on some of these. We have the three, Paula, Bert, and Chris are all joining in via telephone, so you should be able to hear them. All of the attendees are currently on mute, so hopefully you should be able to hear us all, but we can't hear you. But that doesn't mean we don't want to hear from you guys. We keep things muted just to cut down on the background noise, but to participate in this, there's a couple ways that you can do this. I think you all should have a little panel that looks something like this on the screen. That's got a couple, there's a question box there. If you have any questions that come up, just type your question in. That's probably the easiest way to do it. We'll see those questions, and then we can relay them on to the presenters. Also, if you want to ask a question in person, there's a little icon sort of on the top left of the box. It looks like a hand with a little arrow. If you click on that, that's going to indicate to us that you would like us to unmute you, so then you can ask your question to the presenters. So the slide here that I'm showing is the box if you're a PC person. If you happen to be a Mac person, it looks something like this. Still, you have the sort of the big question box in the middle there. You can type your question, or you can click on the little hand with the arrow icon, and that'll tell us to unmute you. Without any ado, I'll turn this over to Kate now.
Great. So I'm going to start by introducing our excellent panel of speakers. You can see their lovely faces on your screen there, hopefully. First of all, I just want to thank the speakers for taking time out of what I'm sure are very busy schedules for this discussion, particularly towards the end of semesters and quarters, and also note that we had to work a little bit to get the 3 time zones all coordinated. So again, great appreciation for the speakers' flexibility with that. So I'm going to start by introducing Paula. Paula Pietromonaco is a professor of psychology at the University of Massachusetts Amherst, where she runs the Close Relationships, Emotion, and Health Lab. Very appropriately for our discussion today, her work focuses on how basic psychological processes in close relationships affect relationship, emotional, and health outcomes. We'll certainly hear more about that shortly. She's one of the lead researchers on the Growth in Early Marriage, or GEM project, which is an NIH-funded project examining the experiences of newlyweds in Western Massachusetts. She's the author of nearly 50 papers that I could find listed on the topics of relationships and health, and these include papers in top journals like JPSP, Health Psychology, PSPP, Current Directions, and American Psychologist, among many other prestigious outlets. As I mentioned, her work has been funded by NIH, particularly by the National Cancer Institute. And so Paula is joining us today from Amherst. Thanks, Paula, for joining us.
Thank you.
So our second panelist I'll introduce is Bert Uccino, and he's a professor of psychology at the University of Utah. His work addresses how social relationships affect or influence health at multiple levels of analysis, including social, cognitive, and physiological processes, again, central to our discussion today. As an example, Bert has found that perceptions of supportive relationships predicted things like reduced cardiovascular reactivity during stress and lower blood pressure, so really key health outcomes. He's authored over 100 papers on these and related topics, and again, top journals like Psych Science, Health Psychology, Annals of Behavioral Medicine, Perspectives in Psychological Science, and Psych Bulletin, among others. His research has been funded by NIH, specifically the National Institute of Aging, the National Heart, Lung, and Blood Institute, and the National Institute of Child Health and Human Development, as well as the American Cancer Society. Bert's joining us today, as far as I know, from Salt Lake City, Utah, so thank you, Bert, for joining us.
Thank you.
And then we have Chris Dunkelstetter. She's a professor of psychology at UCLA, where she directs the health psychology training program, in addition to doing her own research, of course. Her work examines stress, coping, and social support processes and their implications for adjustment and also a variety of health outcomes. Chris's primary focus is on stress processes in pregnancy, particularly the predictors and consequences of prenatal and maternal stress, although she has looked at other topics as well. She's also authored over 100 papers, very impressive, on this and other topics. And here again, top journals, Perspectives in Psychological Science, Health Psychology Review, Clinical Psychological Science, Health Psychology, Current Directions, a long list for all of our speakers. And her work has been funded by NIH for several decades now. So Chris is joining us today from what I can tell you, also being out here, is the sunny and extremely hot Los Angeles, California right now. So thanks, Chris, for joining us. I hope you're in the air conditioning somewhere.
I am. My pleasure.
Great. So for those who may have joined us for the self-regulation discussion, I think this was last year sometime, you may be familiar with this special issue that the paper I sent around is coming from, but just to give a little bit of background on this. So the three distinguished researchers who I just introduced have joined us today to discuss a collaborative paper. So it appeared last year in a special issue of Health Psychology on the theoretical innovations in social and personality psychology and their implications for health. So that was kind of the mission of that special issue. It was edited by three of our SPH members, Bill Klein, Alex Rothman, and Linda Cameron. Last I checked, I think Linda has joined us today at least. Others may be joining us later as well. In this issue, there were several teams of researchers collaborated to write reviews, and they were tasked with providing an overview of the current state of various social and personality research areas that have implications for health researchers, health behavior, and health outcomes. And I would just mention, I went to the issue's webpage, and I thought there was a great description of the goals of the issue, just again to get everyone kind of on the same page of where this is coming from. So the issue is described as having the goal, the desired outcome is to excite interest and new ways of thinking that in turn spawn programs of research poised to advance both theory and practice. Each of the articles reinforces a culture of science in which psychologists of all stripes, social, personality, health, clinical, and others, can work collaboratively to develop stronger models and testable hypotheses with clear applications to enduring health problems. So I think it's a great mission, and also I hope that this brown bag today can actually help move that mission forward as we bring together a group of audience members and speakers from kind of different corners of those areas of research. So specifically talking about this paper that will be the topic of discussion today, Paula, Chris, and Bert were tasked with the job of reviewing the literature on relationship science and the implications of this area for research on health, or in health and health outcomes, which is a difficult task. Those are two very big fields of research. And so they're here today to talk a little bit about the work that they did, how they approached that task, and what they see as some of the challenges and the opportunities at this intersection of relationship and health research, and of course to answer any questions that all of our audience members might have about this very important work. So as we discussed before all of the audience members could hear us, I think what we're going to do to kind of keep things flowing is I'll pose a variety of questions. We'll get questions from some of you in the audience, we hope. And we're going to roughly go in an order where Paula will talk, and then Bert, and then Chris, just to keep things straight. But feel free to direct questions towards specific people if you're interested in hearing someone's perspective. So to get things started, I think I'm going to just pose a very broad question, which is, what is it about this topic of relationship science, and particularly its implications for health, that interests each of you?
Oh, gosh. So everything about this topic interests me. But I think that I'm most drawn toward understanding the mutual influence processes through which partners in a relationship can affect each other's health. Humans are social beings, and so much of what we feel and do is influenced by other people, especially those who are close to us. But we don't really understand enough about the how of this connection. That is, what the mechanisms are through which one partner influences the other and vice versa in ways that might shape later health outcomes. And this is a theme that runs throughout our article. So for example, there's a relatively new area of research looking at how romantic partners or spouses show convergence in their health-related physiological responses, such as cortisol reactions to stress. There are some articles by Saxby and Rapetti, and there's new work in our lab as well by Holly Laws and myself and Aileen Thayer. And I'm very interested in understanding how this type of physiological convergence may, how couples come to sort of share or not share physiological reactions that might predict their health outcomes down the line, and whether that sort of physiological convergence might vary as a function of individual difference factors such as attachment security or insecurity. So that's just one area. I mean, there's really many, many topics. And I'm going to pass this on to Bert to to let him say a little bit about what interests him.
Have we lost Bert?
Okay, well, broad question, but for me, the big issue was trying to think better about how mechanisms might be involved. I think a lot of our theoretical models, at least in the relationships in health literature, don't speak very clearly to these kinds of more fine-grained mechanisms that we talk about in the paper. So that was a big interest of mine, and then also thinking about how we can use those to translate those kinds of mediators and mechanisms into interventions, because I think at least in the support literature, we haven't, those interventions have shown some promise, but also some inconsistent findings. So we need to think better about how to do that based on these kinds of models.
Great, and Chris?
Do you want to repeat the question, Kate?
Oh, sure. It's a very broad question. I was just wanting to start with kind of your personal interest in this, topic of relationship science generally, and also its implications for health. Kind of what is that for you?
So I was going to say that, of course, I'm support the interests that Paula and Bert described, and agree that they are pressing issues for us now. My own interest dates back to my dissertation research on cancer and social support in Chicago in the 1980s, and then we didn't really even understand anything about how social relationships were related to adjustment to cancer. And now, of course, we have a huge literature on that, and we know quite a bit, and yet we don't still know as much as we could to know what to do for cancer patients, for people with cancer, cancer survivors. And so there's still much to be done in that area, which is not where I turned my attention. Early on in my UCLA career here, I turned my attention to pregnancy, and that has been my primary domain. And similarly, I find working in that area that we are still in a very crude stage of understanding relationships and pregnancy and birth and postpartum. There's good work on transition to parenthood, but it is still, of course, evolving in good directions and can become even better, and much inroads to be made. With respect to pregnancy and social support, we're still in the process of documenting exactly what relationships, we know they're important to moms and dads and to the outcomes of the offspring, but we're still documenting so many things that if we could be at a place where we were working only on mechanisms, we'd be lucky. And surely if we could be talking interventions, we'd be lucky. So looking at it from that perspective, I'm interested in the whole gamut, but in making sure that relationship scientists also work within specific disease models and don't speak generically about relationship processes in health. That would be maybe where I want to contribute today.
That's great. Thank you, guys. So thinking about the paper more specifically, as I understand it at least, and feel free to correct me or be a little more specific about this, the task was basically to integrate findings and approaches from relationship science and health psychology. So first of all, am I getting that task essentially correct? And also, it would be great if you could describe a little bit about how you approached that task, kind of what the process was like of figuring out, how you were going to approach what could have been a pretty overwhelming, I think, goal.
Yeah, it was a hard task, and luckily I had two wonderful collaborators, and we bring different sets of expertise to the table. So, so that was really nice. But there is a huge literature and a growing literature within relationship science on the connections between relationships and health, and there's a pretty large literature in health psychology too that looks at relationships. So, so we had to figure out how to do two things. One, how to narrow the literature that's out there and be able to, talk about things in a meaningful way within a strict page limit. And we also wanted to bring something to this article that would be unique from what already exists out there. And so we thought about what kind of model might be most helpful for guiding future research and sort of establishing those exciting new directions that we were tasked with establishing. So we started by considering several major theories of relationships, and those major theories are attachment theory and interdependence theory and an evolutionary approach to relationships, as well as some other sort of mid-level theories. But there wouldn't have been space to adequately talk about each of those approaches and how they would advance research and sort of connect them to the research. So we had to narrow our focus from that. So what we decided to do was to choose one example, and partly we chose this example because it's my area of expertise, and that's attachment theory. And we carried that through the article to illustrate how social psychological theory in the form of attachment theory might be applied to study the connection between relationship processes and health that would get at some of those underlying mechanisms and mediators and give us a handle on not only what leads to health and disease outcomes, but what sorts of interventions might be the most useful to develop and implement. And we also focused on a subset of health areas for the same reason. So we chose domains that would capture processes across the lifespan, which we thought was really important to do. So we talked about areas from birth, pregnancy and birth, to aging, and self-regulation of health behaviors, which can happen at any phase of the life cycle. We talked about cancer as an example of a serious chronic disease that we thought is a particularly important disease, and there was a substantial amount of research to talk about chronic pain, and also issues that arise for older adults. And across all of these areas, what we decided to do was to emphasize the importance of the relationship context. So how both partners in a relationship might influence each partner's health and health-related processes and outcomes. What we found was that most of the research in health within the domain of health psychology had focused on individuals, on patients, for example, and sometimes bringing in the partner's perspective, but that wasn't typical. So we wanted to highlight that individuals or patients are not operating in a vacuum, but are very much affected by their partners and vice versa. And that's sort of the way that I see the process, and I think Bert and Chris can probably add some thoughts and memories to exactly how we went about this. It was interesting at first to sort of figure out there was a lot there, and we had to narrow our focus substantially.
Yeah, I really don't have much to add to that. It kind of jives with my recollection of what we did, but let me again emphasize it was really a pleasure to work with Paul and Chris, and I think some of the non-overlapping expertise that we had was a real strength here. And we hadn't really worked with each other in the past, and so part of it was also figuring out the collaborative process and how that would work best between us. And I think we hit it out pretty well. So.
I would third that. I thought it was great fun to work together. We got together by phone and email, and then we got together at UCLA for a day. And if anything, it further bolstered my sense of team science, in this case within psychology, but just how much you learn and grow, and your research is enriched by that sort of thing, and I strongly encourage it. I also wanted to sort of second or third the notion that this was an overwhelming task. I mean, we could have certainly written a book, and we all agreed on that. And so there are lines in the paper that emphasize reading of some of the overview excellent papers, like the paper by Clark and LeMay in 2010 and by Rees in 2012. Those are mentioned on the first page of the paper. And toward the end of the paper, some other directions in theory are noted. And there are lots of ways one can go. And you know, not any one of us can really do it all. So it's going to require that people deciding to contribute in this area jump on in one of several ways and do some of the things we're recommending. But nobody can do all of it, I don't think. It was an overwhelming sort of agenda that we set out to do, and then it's still an overwhelming task for the field, for everybody.
It's a good start, nonetheless. So, Paula, you started to speak to this a little bit, but I guess I'd like to hear a little more about what it is about attachment theory specifically. I mean, you certainly acknowledge in the paper that there are other approaches or theories that you could have worked with for this paper in terms of relationship science, but that attachment theory seemed maybe like a particularly productive approach to bring these two fields together. So what is it about attachment theory that makes it so useful in the context of understanding health outcomes or in moving this field forward?
Well, one thing is that it's largely a theory about how people regulate their emotions when they're under stress, when they're faced with a stressor, and so it's relevant for health in that sense, right? Because if you're diagnosed with a serious illness, that's going to be a threat, right? And so how you regulate in response to that, how you regulate in response to just daily daily events related to health also maybe is importantly connected to attachment as well. The other piece of the theory that's relevant is that attachment has a lot to do with how people seek out care from others, you know, whether they do it, how they do it, how they go about seeking support. And we think that support is a key piece of what it is about relationships that connect relationships to health, and also how they provide care to others. So if you think about attachment in the context of early parent-child relationships, you can think about the parent as the caregiver and the child as the recipient, as the attached person. But within the context of adult relationships, both people are going to be seeking care, both people are going to be providing care to their partners. And so the way that the lens through which they see their relationships, and that lens is related to their sort of individual differences in attachment style, is going to be really important for how they go about both of those tasks, care seeking and caregiving, and both of those things are going to be important in the context of health. So that's part of the reason. Those are part of the reasons that we saw attachment theory as being particularly important. The other reason is that so much of the literature in relationship science now is driven by attachment theory. It's just a huge, major, overarching theory that has driven a lot of relationship science research. So we thought that that also made it particularly reasonable to focus on attachment as well.
Bert or Chris, do you want to add to that at all?
Yeah, to me, I mean, although I think there's certainly less research linking attachment style to health, at least compared to things like social support, there is a relatively large literature linking attachment style to social processes that we know are health relevant, like social support and social conflict or negativity. So I thought that was a good bridging point that would allow us to make the kinds of connections about mediators and mechanisms that might be of importance both to theory and intervention. So I thought that was a really good choice as well.
I don't have anything to add. I think, you know, you have to start somewhere, and attachment theory was a good place to start, and Paula knows so much about it, and there are wonderful other contributors in that area.
Great. So another, I think, point that might be useful for the audience, I'm guessing most of the attendees have read the paper, as have I, but we're curious, or I'm curious, I guess, from your perspective, to maybe summarize the key take-home messages from the paper. I'll prompt some other specific questions about future directions or how it might have changed your research after working on the paper, but sort of as just a very broad question. You know, what do you feel like from this paper people should take away in a succinct sense?
Okay, so we know from a lot of research that relationships, especially close relationships, are tied to health and health outcomes. And the general findings are that people who have close supportive relationships generally show health benefits, and those without close social bonds or without much social integration carry more health risks. But we don't know, so a key point point sort of driving a lot of things we talk about in the paper is that we don't really know that much about the mechanisms that get us from close relationships to these health outcomes down the line. So some of the mediating mechanisms that Bert was talking about earlier. So a major goal of our article was to suggest ways that researchers could test those mediating processes and their effects on later health outcomes. And what we suggest in the paper is that relationship science offers well-developed theories of close relationships, with attachment theory being one example, that can help researchers generate hypotheses and guide their research designs in ways that will allow them to test processes or mechanisms through which relationships shape health-related physiological responses, health behaviors, and then downstream health and disease outcomes. So a key point of the paper was to present a general theoretical framework, and I want to stress that it was a general framework, not the only framework. It can be modified in multiple ways. That general framework incorporates ideas from attachment theory as well as research on relationship processes more generally to illustrate how a strong theoretical perspective can be used to generate hypotheses and guide future research. The general model that we presented, some of the aspects of it that I think are especially important features are that the model is dyadic, meaning that each point in the model, the responses of one partner, we could say partner A, can influence those of the other partner, partner B, and similarly, partner B's responses can influence those of partner A. And another important point is that this reciprocal influence occurs not only at one time point, but it's a continuing process, and it operates in a dynamic way over time. So some of the key points are that the influence of one partner on the other is important for understanding the connection between relationships and health. That research needs to focus on testing potential mediating processes that underlie that link between relationships and health, and that individual differences, such as differences in attachment orientation, how people approach their relationships, what their mental representations are like, that those individual differences might alter how relationship processes shape health behavior and outcomes. And that this is an idea that has important implications for things like couple-based interventions. So one thing that we talk about towards the end of the article is that an intervention strategy that works well for a couple in which both partners are securely attached to people who are comfortable with closeness and intimacy and so on, a strategy that works well with that kind of couple may not work as well for a couple in which, let's say, one partner is avoidant and uncomfortable with intimacy and disclosure. An intervention that tries to get that person to open up and disclose a lot might backfire. And so what this suggests is that couple-based interventions in the health arena need to move from what seems to be, in the majority of current work, a one-size-fits-all approach to more tailored interventions that take into account the individual characteristics of each partner and of the couple as a whole, such as each partner's attachment style. And so overall, we think there are a lot of exciting opportunities to apply theoretical perspectives from relationship science to both research and intervention efforts in novel and creative ways in the health domain, and that both relationship science and health psychology are going to benefit from this sort of endeavor. Bert, would you like to add?
Yeah, I agree with everything that Paula said, and I guess the only thing I would add is, to me, it also emphasized the importance of kind of a multi-level analysis of complex, multiply determined health phenomenon. I mean, in this paper, we've integrated work on social processes, individual differences, cognitive processes, behaviors, and biology. And so I think it's a good model for thinking about how these kinds of psychosocial risk factors may ultimately impact health and disease down the line.
I don't know, John, if you want to put up the third page of the paper, which has the model.
Fortunately, I only have a picture of the abstract.
Okay. Well, for those of you on the call that might have it, figure 1 is this picture we're alluding to, and I thought maybe it would be worth mentioning that when health psychologists talk about mechanisms, they are talking about physiology, affect, and behavior as it links things like relationships to health outcomes. And so when we say mechanisms in this conversation, it can get confusing because relationship scientists are more often talking about relationship mechanisms or mediators like whether a partner is responsive or satisfied or committed, which is shown in the figure. And I think we've all still got to work on figuring out our terminology. But in any case, Paula mentioned that one of the key things that we are emphasizing here is truly looking at dyadic processes, which is virtually, very, very rarely done in health research for a lot of reasons. In the work that I do, we don't have enough time usually to do a dyadic interaction task in the lab with parents because it isn't our main focus. We sometimes are able to interview mothers and fathers. We then might look at some theory-driven thoughts on social support or negativity, which are interests of ours, but we often can't get so far as to measure responsiveness or, some of those other, quote, relationship mechanisms. On the other hand, we'll be top-heavy on physiology and affect and health behavior because those are the health mechanisms. So it's an interesting sort of set of tasks that we've suggested that people do, and it probably is going to require that projects be focused on these relationship health processes as their primary focus. Just to add, importance of dyads, which Paula mentioned, and the importance of the reciprocal influence in the dyad, not just knowing what one partner and the other partner are contributing, but of what's going on in their interactions and how they influence each other. And then of gender. Gender is one of those things that sometimes pops in and pops out of our psychology. We don't always focus on it, and in some ways it's a foreground here, not just a background. It depends on whose work you're looking at, but certainly really important thing to highlight, and that we did highlight.
Absolutely, and so we now, I think, can everyone see the model? We now have the model up on the screen for anyone who's interested. It's also in the paper, of course. So I think this next question was touched on in your responses to the last one, but if you have other things to add, I'm curious what you think the most interesting or promising or maybe even most important directions for kind of near future research in this area might be. That was certainly a big part of, I think, the goal of the paper and what you achieved in it as well.
I'll just mention a few directions, and then I'll turn it over to Bert and Chris as well. But one area that I think is particularly important and where there's a lot that could be done is developing and testing interventions that take into account couple characteristics. And I recognize the difficulty of doing this. So once you move into a healthcare setting and you need to build an intervention, there are practical issues that you have to deal with, so it can't be too complicated. But I do think that we could do something where we take into account the characteristics of the couple. We know close partners are incredibly important for behavior, can be potentially incredibly important for behavior change or adjusting to a chronic illness, and any work that might improve the effectiveness of couple-based interventions, which I think the work right now by Mark-Ray and others suggests that they're somewhat effective, but not as much as we would like. And so any work that advances that, I think, has the potential to have a quite significant practical impact. So that's one area. Another area that we noticed was where the research was scant was in terms of health behavior and how couples might impact each other's health behaviors. I know there's some work along these lines, but it did seem to me, as far as I know, to be an area where it's wide open for people to step in and begin to conduct more systematic research on how partners can promote each other's healthy behaviors or help them change, I guess, unhealthy behaviors as well. So research that better connects what we know about close relationships to understanding how partners influence health behavior change or can influence one partner's adherence to a medical regimen is another direction that I think has the potential to make a big difference in how successful people are at engaging in health-promoting behaviors. There are other areas that I'm interested. I mentioned one before in terms of physiological convergence, but I think those are two areas that come out as being practically very important from a practical perspective. And I'm going to pass this question on to Bert and Chris as well.
Yeah, for me it's also the importance of modeling dyadic level processes. We've done this now in a couple of papers that was a result of this collaboration, and it's been very fruitful for us. The other thing I wanted to emphasize is that there's just when you look at that model, there's a lot of different pathways here, and a lot of the research in health psychology kind of looks at bits and pieces of this model, but the other thing that I think is really important that people start to test the full model. And so there's lots of mediational pathways there, and you can approach it via covariant structure modeling or other kinds of mediational approaches, but at some point we need to test more of the models in combination. Even if you were just to take like one half of the model in partner A, like going through the stream of processes and testing that directly in relevant analyses, I think is really important, and then expanding that then to the dyadic perspective, I think that's going to be really important for us in the future.
Agree with all of those things. Some things we emphasize in the paper are more relationship science with diverse populations, understanding the relationships of those who are very low income, for example, or specific cultural, ethnic, and racial patterns in relationships that haven't been delineated and what their implications may be for health. And then related to that, translational science is really important in health psychology and in broad health-based science. And I think relationship science is prime right now for translation, for figuring out, as we say in the paper, couple-based interventions that are tailored to fit specific orientations of individuals and their partners. And so, you know, I think there's quite a lot of very exciting directions that can be taken in this on the basis of what we've argued.
Great. So one of the things that I noticed in the paper, and I think it was a great case that you made, which is for the need to do more research that explicitly uses a dyadic approach. And I think some of you have just mentioned research directions that may not require those dyadic approaches, but certainly it's key to kind of pulling in all the paths in this great model that's on the screen. So I have never used dyadic approaches, but my sense is that they're probably not super easy to implement. There's some practical barriers. So I was curious from all of you if you have advice that you might give, especially young researchers who have interest in kind of bringing some of these questions forward and using dyadic approaches, how they might overcome some of those hurdles.
I mean, there are hurdles, but they're surmountable. One thing young researchers might do is just make sure that they have a good toolkit in terms of statistical analysis. So once you do move to studying dyads, you do need to know things like hierarchical linear modeling and structural equation modeling and all of the things that they didn't teach me in graduate school, but that I've learned, begun to learn later. So those approaches are very useful in terms of the actually conducting the studies. It is, I mean, you have to get at least 2 people into the lab, or if you're moving to family research, which is beyond dyads, right, triadic approaches, it does become more complicated, but it is doable. You have to be creative and be persistent in terms of getting people into the studies. I do think that it becomes more challenging when you move into a healthcare setting. So we're in the process now of developing research with cancer patients and their spouses, and it does become much more difficult as you enter healthcare settings. But I also think those difficulties are surmountable. Bert and Chris have both worked more in healthcare settings than I have, I think, and so I'm going to pass this on to them.
I guess the question was the question like specific references or resources?
Or, yeah, I mean, anything that might be helpful to someone who's thinking, yes, I want to do this, how do I do it?
Yeah, for me, there are a couple of things that I always turn to. I wasn't trained in these kinds of analyses, so I really had to kind of pick up books and learn on my own. But one of them I always go to is the Campbell and Cashy. In 2002, I believe, they have a tutorial in personal relationships that's really excellent and guides you how to do this within the context of HLM or Proc Mixed in SAS. That's really, really valuable. The other one is the dyadic data analysis by David Kenny, Cashy, and Campbell. That's also an excellent, more extended treatment of some of the statistical and theoretical and conceptual issues you need to be aware of. But I mean, the other thing I would recommend is nowadays things have gotten so complicated. I think for social psychologists, oftentimes we're really well trained in statistics, but it's getting more difficult now for even social psychologists to stay aground with what's going on in statistical theory. And so just really collaborate with a good statistician or a quantitative psychologist and make sure they check your work basically as well, even if you feel sometimes you feel like you may be comfortable with it. That's an approach I've taken as well, especially on grants, where even if you may have the experience, oftentimes you will want to see a quantitative psychologist or a statistician on your team.
I second that. Yes, absolutely.
I agree. I was going to mention the quantitative training side. I think that dyadic analyses are not for the faint of heart in the quantitative domain, and that it's good to be well trained and to work with mentors and collaborators who are strong in that area, and to realize that's what you're taking on if you're going the dyadic route. So, but as far as other advice for students, I think I'm sorry, I think I lost my train of thought there, but I think there's so much excitement here that it's an area that's a frontier, and that students and trainees working in this area can really feel like pioneers sometimes. And that's a great, there's lots to base your work on, but you can also be going off in brand new directions. Oh, I know, it was about healthcare settings. Do you want me to comment on that?
Yeah.
Yes.
Healthcare settings aren't the only place you might get couples. So in healthcare settings, we often would recruit someone who's in treatment or diagnosed, and then you might separately be recruiting their partner, who may not be in that setting, who probably isn't going to be found there, more easily will be found by asking permission to contact them. And then you may want to study them in their home or in some other setting, but not necessarily in the healthcare setting. So I wouldn't say that you have to be in the healthcare setting to study couples. In addition, a lot of the things we're interested in, like let's say health behaviors in diabetics, where diet might be important, type 2 diabetes, they may be found through support groups for diabetes or online chats or a variety of places. If we study pregnancy, some of the early work that people did was recruiting couples through Lamaze groups, or recruiting them maybe through hospital classes where they're getting ready to give birth. So healthcare settings are very challenging, and I would suggest that unless you're already tied to projects based there, there are lots of ways to do this without having to go there specifically.
And I wanted to add one more thing as well for students who are interested in these statistical methods, that in addition to going to people at your university who have expertise, you may not. I mean, sometimes you may not have people with that kind of expertise at your university, and there are often summer workshops. There are summer workshops at University of Michigan, they're at University of Connecticut, here at UMass. I'm sure there must be some on the West Coast as well. And just attending some of those summer workshops can at least give you an introduction to things like hierarchical linear modeling and so forth, so that you kind of want to have a basic understanding. Even if you bring on a consultant, you want to understand enough about the method conceptually so that you also can check what they do. Maybe not in terms of the exact mechanics, but that you understand at a conceptual level what it is that they're doing and why you're doing a particular kind of analysis. So I would encourage you to take not only courses at your university if they're offered, but also to take advantage of all these many summer workshops. I think Alan Reifman actually has a website that lists all the statistics summer workshops in these various methods as well, and so that's another great resource.
Great, that's incredibly helpful. I'm sure those resources will be useful to our audience. So on a slight change of topic, I think we have a mix of audience members who are maybe more on the relationship side and others who are more on the health side, and then many at the intersection. So my sense reading your paper is that it's a great start to a conversation about what health psychologists can learn from relationship scientists and kind of what we know about that direction, I guess. But I was sort of wanting to flip the question and ask what you think that relationship researchers, maybe those who have not thought about the health implications of relationships, can learn from health researchers. That's a little bit of a vague question, but I guess I was just wondering, for those who are sitting here thinking, okay, I already know about relationships. I do that already. What can I learn about from health researchers?
That is absolutely a great question, and it's something that I learned. I feel like I learned a lot about health psychology by writing this article with Bert and Chris, because one of the things that Chris told us early on is that it's not just unidirectional. It's not just from what can social psychology offer to health psychology, but what can health psychology offer to the study of relationship science and from a social psychological perspective. And health psychologists have expertise in connecting these issues to particular health problems. So actually, I would just talk about, before I wrote this paper, I would say, oh, health outcomes. And Chris was very quick to tell us that you can't talk about health outcomes in general, and Bert as well. You can't talk about them in general. You have to look at specific outcomes, and the processes might be different for one disease than for another, or for one particular kind of health behavior than for another. So we can learn a lot from health psychologists about the particulars of particular kinds of diseases and particular kinds of health behaviors, as well as connecting research into healthcare settings. So I think there's and within health psychology, there are theoretical perspectives as well on, even within relationship science, right? On how, on how couples interact around health issues and things like that. So there's a lot that can be gained for social psychologists by talking to health psychologists and learning from them. And I'm going to pass this on to Bert and to Chris, who, again, Chris in particular has much more expertise in this area than I do. And I think she can tell us everything that we can learn from health psychology.
Actually, for me, when I think about, whenever I read, for example, social psychological work on some of these processes, sometimes for me it's not as clear what the rationale is for including some of the biological assessments in particular. Mm-hmm. And I think, I agree with what Paul said. I mean, a lot of health psychology is about disease-specific processes. And so there needs to be a good, like the model is very general. It says physiology, affect, and behavior, but that's within the context, or should be within the context of things like cardiovascular disease or cancer or infectious disease, et cetera. And all those pathways might be different depending on what those mechanisms are. So more specificity to me in looking at biology and the importance of biology in theoretical modeling for social psychology, to me, would be one big thing that social psychologists could take away from this.
Mm-hmm.
I surely can't tell you everything you can learn in health psychology. But first of all, what I would say is that it's important to look at the best health psychology research, just as it would be important to look at the best relationship science. So, there are a lot of different interdisciplinary folks studying relationships, and some of it's great and some of it's okay, and some of it's kind of weak. And we tend to read all of it because we want to know as much as we can, but then we tend to base our work more on the best science. The same is true in health psychology. A lot of people work on health topics from a psychological standpoint, and the work varies. And so, there are journals you can read and places you can go and learn very important findings with reference to a specific health outcome and relationships. But I would always be a critical reader of them as a psychologist from the standpoint of theory and methods. We in psychology use outstanding theory and methods. That should be what you're looking for and looking at in health psychology, and it does exist. So, for example, in health psychology, there is excellent work on health behavior, health models of health behavior, ways of measuring health behavior, limitations in ways of measuring them, and all of that would be important to be familiar with if you're going to want to go to the health behavior route of the mechanisms. Similarly, there are theories and methods that are very important to know and understand in biology. The big criticism of the way psychology picked up cortisol early on was people just plugged it in. Oh, we can take some salivary cortisol samples and learn something about, maybe explore some links with blah, blah, blah. And, there's a whole science around understanding the HPA axis and how it's linked to behaviors, to many psychological constructs as well as health outcomes. So that would be important to know and read that stuff. Being specific, one good paper that gives you some of the best in health psychology is an annual review of psychology paper by Miller, Chen, and Cole in 2009. I happen to love their work, but nonetheless, this paper on developing biologically plausible models linking the social world to physical health is exceptionally good and a great thought piece, good for reading and discussion with others. So, the only other thing I would add is that I always tell students when they're in health psychology, don't be a dilettante. Don't say, I study cancer, unless you've read and understand what cancer is. Cancer is a very complex set of diseases and mechanisms of disease. And I personally don't really know that much about it anymore. I now work on pregnancy and birth, and I'm lucky if I can keep up on that from the science and biology and health standpoint. So again, you got to be pretty serious. You got to be a great scholar, and you got to look at the best and look in detail at what you do. I always say that, and I think it's so exciting when you do. I'm not trying to deter anyone. This is very exciting to be able to bring things together and read different literatures and do a good job of it.
Great. And Chris, I have to tell you that Tracy Mann has chimed in here and said that, in fact, you can teach us everything we need to know about health psych and that you've done so for many people.
No, Tracy Mann can, though. Tracy Mann can. Hi, Tracy.
So we have a couple more minutes. I just have a few more questions. One is how the process of writing this paper might have influenced your own research. I mean, obviously, you're all much experience doing research coming into this process, but I wondered if the process of collaborating and thinking through these issues may have prompted any specific new studies or changes to current studies or just kind of generally new questions, new collaborations.
I think it's definitely influenced how I think about my own research and in the work that we're planning. So overall, as I said before, it's given me a much greater appreciation of the literature in health psychology and pushed me towards reading and exploring that literature in ways that, I mean, I always looked at it, but in ways that are more in-depth. And it's really sort of led me to understand how my own work can benefit from research in health psychology. So in that way, it's affected my own work. And I think it's leading to some new collaborations as well. Collaborations in progress.
Great.
Yeah, for me, too, it's really had a big impact on the way I think about things, too. And in particular, the dyadic approaches that I was kind of mulling about for a while, but hadn't really taken it as seriously until after we started working on this paper. And as a result of this, now we have a couple of papers that we got published looking at dyadic approaches, looking at relationship ambivalence in particular. So it's had a really big impact on me there, as well as thinking about how to better model. I mean, if you take, for example, the social support literature, we know very little about what the mechanisms are so in that middle box there, relationship behavior, mediators, and outcomes. We know very little about what those kinds of mediators are like, linking social support to physiology or health behavior or long-term health outcomes. And so it's really helping me to think about an extended set of mediators that are conceptually important and can inform some of the literatures that I'm very invested in. So.
To be honest, I have been busy since we wrote this chapter, and it was this web call that made me think about what I was going to do about this great agenda. And one of the things I happened to realize is that there's a postdoc looking to come here who is interested in social relationships and health, and in my area, in pregnancy and birth. And I thought, I'm sending her this paper, and we'll start talking about how that could shape the postdoctoral work. So anyway, that's the latest way of thinking about it. I've also encouraged several people at UCLA to join the call and live and learn from this sort of paper we've published in an attempt to guide others, and because we were asked to. And I guess, again, I continue to feel, and I don't know how it affects younger scientists, but I know for anyone who's post-tenure that collaborating is just the way to go, Mm-hmm. And so forging more collaborations in this area would be my first step to, and I've recently started collaborating with Darby Saxby at USC in some analyses that will be on couples, Grace Jackson at UCLA, Ben Carney's nearby. It's only a matter of how much time you have in a day, but I would encourage people who are in places that aren't maybe perhaps as rich in opportunities to reach out on the internet and email to people who do this work. I get emails all the time from people saying, well, I'm going to be there, and what about this, and what about that? And I try really hard to connect people with other people and spend time with them and make it possible that people can work together, because I really see the best work is coming out of collaboration. So if this paper enables people to connect more, to read each other's work and find ways to collaborate, that would be great.
Yeah, absolutely. So in our last few minutes, just one last question, and that is, this paper's been out for, if I have the date right, almost exactly a year now. And so I was curious for each of you, the kind of feedback that you've gotten, maybe specifically from people who are more, pure relationship researchers or more pure health researchers, if you've gotten a sense of how people are responding to this paper.
Well, people are not necessarily honest. I mean, they're coming up to you and saying, they usually are positive in most cases. So so I don't know how representative the feedback that I've gotten is, but the limited feedback that I've received has been pretty positive. And when I've assigned this article, or somebody's come up to me at a conference who's read the article, that does seem to resonate with students across areas, and certainly in social psychology and clinical, and to some extent I've had people in health psychology come up and say they've read it and that it's been helpful in some way. But like I said, I don't know that people really sort of are saying to me, what they truly think. I do know that as a direct result of this article, I was invited to give a talk in Israel in fall on a conference on attachment and health, and the audience is going to include scholars and students and practitioners in psychology and social work and health-related professions. So that suggests a positive response across different areas. We'll see. I may have a better sense after I see how people there react to it. And I'll pass this on to Chris and Bert and see what they've heard.
Yeah, I've mostly heard from people in the attachment literature, and certainly the feedback has been very positive in terms of the utility of being able to look at the full model and what it might look like and how it would translate long-term and even short-term to health outcomes. So I think that's been positive. Also on ResearchGate is probably one of the articles that I get the most requests for. So I think it's been, at least from what I've seen so far, been positive.
All the feedback I've had is positive. People were excited when it came out. But I will say this. I think that if we want health psychologists to understand what we're saying in this article, we have to show them. And that means you have to do stuff like Paul is doing, and you might have to do a panel at APHA or more health work at APS, by which I mean Association of Psychological Science or APA, and show people what we mean. Not just say it, but show it.
It's a great call to action to end on. So I want to thank, obviously, our three speakers. Thank you so much for taking this time, and this was incredibly helpful, and we'll have this on the SPH YouTube page for anyone who is attending and wants to listen back to this, or for anyone who might have missed it. And thank you all who have been out there listening for your attention. John, do you have any closing issues?
No, this has been great. Really, really informative. So thank you, Paula, Bert, and Chris.
Thank you so much for organizing it.
Thank you very much. It was fun.
Great. My pleasure. Bye, everybody.
Bye.
Goodbye.
Bye.